how I set up an operating room in the morning as an anesthesia resident. The first thing that I do is I check the ventilator. The fancy new ventilators basically check themselves, but we have all sorts of different ventilators, so I think it's good to know a few things. One, I want to know that when the ventilator is delivering a breath to the patient, that there's no leak. I also want to know that if the patient's breathing on their own and I'm using the bag, that is also functioning appropriately. And then I want to know that the oxygen supply is perfect, okay? Next thing that I do is I get my airway roll ready. So I set up almost every day for an endotracheal tube where I work because my patients are very sick. So set up for an airway, endotracheal tube, laryngoscope, whatever additional things that I need. Then I drop meds. Usually what I'm thinking about is how am I going to put the patient to sleep? How am I going to keep them comfortable, so as little pain as possible? And then how am I going to monitor the hemodynamics? So drawing up pressors or medications to lower blood pressure. And then lastly, I'm setting up for all of my lines and monitors. And just because I'm neurotic, I do check for emergency equipment like an ambu bag every single day. And that's what I do. Drop your questions in the comments below.